I mean, beyond the bit that he's also spoken about, one key area that is also bothering us a lot has to do with our environment, especially the filth around us. I mean, last year, for example, virtually a greater part of the society was battling things like cholera, and in the process a lot of people were killed. These are things we keep having sporadically or year after year. Sometimes we're able to get a bit of a break and then they bounce back, and sometimes when it comes into when it comes to the fore, you realize that we lose a lot of lives. And these are things that elsewhere they have been able to manage sanitation, the filth around us, to a point where some of these diseases don't exist anymore. So the fact that we keep polluting our environment is also part of the problems we are having. I mean, all the data shows issues relating to cancer, galamsey, all the things we've spoken about. So aside the non-communicable bits, the vaccine preventable bits, one key area we need to pay a lot more attention has to do with our environment, especially the sanitation aspect.
So our failure in environmental management and harmony is actually putting a lot of burden on the healthcare system.
Exactly. I mean, beyond the cholera and the rest, when you are in the clinics, you are there and virtually every day somebody will present with one form of gastrointestinal infection or the other. And when you go through the history, you do the test and what have you, it's very clear. It's a contamination around us. People are eating contaminated food. Food is not, sold under the right hygienic conditions. People are supposed to be tested before they even sell food, but nothing happens. Even so-called top restaurants, sometimes you go to them and the kitchens are full of filth, rats. So we are in a certain state where we really need to pause and address some of these issues. They are very important.